And good evening, and welcome to the Ask Dr. MJ Facebook and Instagram live broadcast. We are here this evening to give you infotainment, entertainment, information, and to answer your healthcare questions. As always, we want to thank you for taking the time to participate in our outing because we know you have options, lots of things you can do, lots of places you can go, but we're hoping that you are here because you find this informative. So what we want to do is have each and every one of you, you are our healthcare ambassadors. When you hear something here on this site, I want to make sure that you're sharing that information. So you can either repost some information, or when you're in conversation, when you're at the barbershop, gentlemen, when you're at the beauty shop, ladies, when you're at family gatherings, when you're sitting around the dinner table this evening, you can share. You can say, one of the things that I heard and or I talked about was this. And so we want to make sure that you're taking the opportunity to do that. So on our, this evening, we're going to talk about a couple of things. I want to know that for the ladies, the females listening to artists, and for the gentlemen, for the ladies in your life, we want you to bring to their attention some of the new guidelines and diagnostic techniques that are available in reference to routine mammogram screenings. So as you know, about 3 years ago, the recommendation came out that women didn't have to get mammograms on an annual basis, not once a year. What has happened since then is that the rates of breast cancer and later stage diagnosis has increased. So again, I've always stated that those guidelines were not appropriate for women of color, particularly African-American women. So if you are age 40, if you have a family member that has had breast cancer, you are any age, particularly a first-degree relative, a sister, a mother, then you need to be screened at whatever age you are immediately, and you need to continue to be screened annually. Now, insurance companies are going to push back, but when you share that with them that you have a positive family history, then they should perform those screenings without question and without hesitation. So, but one of the things that has come into the routine mammogram is an X-ray of the breast tissue. Now, it has not been unusual for people to have a primary mammogram performed and then get a request for an ultrasound because of something that was found or not found on the regular mammogram. But now we have gone to MRIs of the breast and now MRIs with contrast. So if you get a contrast, it means they're going to inject some contrast dye in your veins. It's going to go to the breast tissue. And what that will do is identify different blood flow, and it could be vascular to that, supplying blood to a growing malignant lesion. And so it makes a cancer easier to diagnose and to pick out. But one of the challenges that they have found is breast density, how dense your breasts are. And if you got the mammogram in the last year, you'll notice that one of the things that's commented upon is how dense the breast tissue is. And if you have moderate to substantive or significant breast density, then it's going to compromise the ability of a routine mammogram to get the information that's needed. So you probably will get requested to come back. This is not saying that you have breast cancer. And I've had so many women that were so afraid. They told me to come back. They said I had cancer. They didn't say that. They said that they couldn't see well because of the density of the breast. And so they want to perform at minimum an ultrasound, at maximum one of these new MRIs of the breast. So if this happens to you, or if you see that you've been told that you have dense breasts, do not hesitate. This is not an attempt to overdiagnose or overtreat you. Do not hesitate, because a lot of abnormal mammograms are missed because a woman has dense breast tissue. This is, again, more common in women of color, but it's not more common in necessarily women that are larger, smaller, whatever. It doesn't matter from that perspective. But if you have, if you can feel, if your breasts feel firm. But if you're doing self-breast exams, which Dr. Collier recommends that you perform in the shower using soap so that your hands and the tips are slippery, you put one arm up to isolate the breast, you trap it, and you feel all over the breast so that you become familiar with your breast anatomy. And when you feel that breast anatomy, you are the first person that can say something is not right. I feel something different. And you bring it to the attention of your healthcare provider. You ask for a thorough breast exam and then make sure that you're getting your annual mammogram test. mammogram testing again. So if you are told that you have dense breasts, you're at minimum probably going to be requested to get an ultrasound of the breast, or you may even go to the next level and get the new MRI technology of the breast. So ladies, that's what we have for you tonight. And gentlemen, if you have a lady in your life, share with her. One, if she's age 40 or over, she needs to get a mammogram every year. If she has not had it, it is not a fun test. It is not a fun test. Ladies don't like it because they have to compress the breast between two plates, and that's no fun. But we clearly understand the necessity. It is a necessary evil so that we can do those screening tests. Again, a positive mammogram doesn't mean breast cancer either, but it definitely makes you want to look further. The only way to diagnose breast cancer, or any cancer for that matter, and I got this from my good friend, the pathologist, Dr. Jan Kennedy. Her statement is, it is not cancer until the pathologist says that it's cancer. So more often than not, lumps are just benign lesions that you can follow, you can remove, you can do whatever. But if it happens to be a malignancy, then you can be aggressive. Early diagnosis leads to better outcomes. And we want you to be, a person that if you were unfortunate enough to have breast cancer, a year later, you're saying I'm cancer free now, I have defeated this monster, this threat. So thank you so much for tuning in. Now, Hailey, let's do the roll call. Who do we have? Okay, Jamie Lee from Chattanooga, Tennessee. Thank you, Jamie, for tuning in. We appreciate you. Mimi, hey, Mimi, how are you doing down in Tampa, Florida? Okay, unless she's in Atlanta tonight. Mary B from Macon, Georgia. Hi, Mary. Thank you so much for tuning in as well. Sharita Ward, good evening. I hope all of you ladies found the information about mammogram testing good. Hey, Chris Goodjohn, good evening from Greenville, South Carolina. I want you to give me a good report on the Lipo T. Makiba Boland. Hi, Miss Makiba Boland. Thank you so much for tuning in from Douglasville, Georgia. Sean Big Time Green, good evening from Monroe, Louisiana. Sean, I appreciate you. Sharita Ward, all the way from Claremont, Florida. Thank you, Sharita. We're so glad to have you. Keith, good evening from Jacksonville, Florida. Hi, Keith. Thank you so much. Rosemarie from Pittsburgh, Pennsylvania. Thank you, Rosemarie. Winnie King. Hey, Winnie from Terrell, Texas. We are glad to have you back. Andy Barron from Daytona Beach, Florida. We are now moving down the west coast of Florida. Riley from Tallahassee, Florida. Thank you so much. Coming down that way at the end of the month. Venus Black, good evening from Rockford, Illinois. Sheila Owens Pete, good evening from Tulsa, Oklahoma. Thank you so much for tuning in as well. Laverne Jackson from Mount Dora, Florida. Hi, Laverne. Thank you. All right. Shondell Thomas from Indiana. Thank you, Shondell. We appreciate you for tuning in. Jackie May from Birmingham, Alabama. Hey, Jackie. Thank you. Audrey Ngalu from New Orleans. Thank you, Miss Audrey. Thank you so much for tuning in. Vicky Marsh from Indianapolis, Indiana. Thank you, Vicky. We appreciate you. Erica Bell, good evening from Orlando, Florida. She is here. Thank you, Miss Erica. Evelyn Williams from Jackson, Tennessee. Thank you, Evelyn. We appreciate you as well. Mary Haddon, good evening from Covington, Georgia. Okay, we are in Georgia now. What about the north side? New York, New Jersey, Midwest. We want to hear from you. Wendy Moffitt, hey, from Meridian, Mississippi. There we go. Anna is from Charlotte, North Carolina. Charlotte, North Kakalaki. We're glad to have you in the house. Trish Simmons. Hey, Trish, how you doing? Also from North Carolina. North Carolina representing. Chili Will from Stockbridge, Georgia. Chili, so good to hear from you again, my friend. I want one of my males to, again, give me a report on their benefits from the Lipo T. I tell you, the Lipo T, God's gift. I had a patient today. The last time we saw him, a normal testosterone level for a man is 300 to 900. 300 to 900. His presenting testosterone level is about 154. So that is actually lower than some female patients that I have. And he was having lots of problems and symptoms. Today, we retested his testosterone levels 448. So he's feeling much better, doing much better, and wanted to express his appreciation for me turning him on to the Lipo T product, and he was ready to get more. And I told him, don't worry, it's not going to run out. We have it. Dr. Collier highly endorses using the Lipo T. It can be life-changing for men. Remember, we got the Lipo E coming out for the ladies. Look for it. It's going to be out there soon, giving you all the same benefits that we are offering our male patients with the Lipo T. And remember, we got the new Lipo Drops Night. That is a different fat-burning combination that contains some great products that will help you lose weight even while you're sleeping. So we're going to offer you a lot of more information about that. Go to the website. Of course, you can always do that. Remember, Facebook Live and Instagram. This can be reviewed on the website lipodrops.com. It will be continue to be available for you, and it's always archives on our YouTube channel at Ask ASK Dr. MJ. You can do that as well. So, okay, let's get to it. This is the People Show. We want to find out what your questions are. So, Holly, let's spin them down. Okay. Mary Haddon, how are you? My question is that I have been diagnosed with high platelets, and I'm on this medicine called hydroxyurea. What vitamins do I need besides vitamin D to combat this illness? So that is an inflammatory condition, and the way to treat inflammation is with anti-inflammatories. The vitamin D is the body's first natural anti-inflammatory, but I also highly recommend that you take the omega-3 fish oil product. And for the few patients that are allergic to fish, you can take flaxseed oil as an alternative that is non-fish based, but a very good source of omega-3 as well. Omega-3 does so many wonderful things as far as inflammation is concerned, but it decreases the coagulation of platelets. And when you have high platelets, platelets clump together, form clots, which result in heart attacks and strokes. So the objective is to not allow those platelets to clump together inappropriately. You want platelets to work if you get cut. If you're bleeding, platelets stop the bleeding. They literally will form a patch to close a wound. Everybody's had some bleeding incident at some point, so you understand this phenomenon. But when you have the platelets are too high, it can cause inappropriate clotting of the blood, which can lead to a variety of different problems. So we want to make sure that you're on hydroxyurea. I would also recommend that you take a low dose aspirin, 81 milligrams per day. That will help with that as well, Mary. So yeah, the vitamin D, the omega-3 fish oil, add a dose of 3,000 to 4,000 milligrams per day. 3,000 to 4,000 milligrams per day. And the vitamin D, of course, at 5,000 international units per day. Difficult to find that dose, go to the website lipodrops.com. That is the standard dosing for our Doctor's D vitamin D3 product. One pill, one caplet, tiny little caplet per day. Again, it's part of Dr. Collier's treatment regimen, Dr. Collier's trio for good health, which includes the vitamin D, the omega-3 fish oil, and probiotics on a daily basis. Life-changing supplements that can make you look better, feel better, and help combat a variety of different disease states. Thank you so much, Mary. Okay, Don Needy. My husband was diagnosed with atrial flutter about 4 years ago. I feel they'll give him all of this heart medication and no other heart-related issues. Could it be from his stomach? No. Atrial flutter is a very easy to diagnose. It gives you a sawtooth configuration on a standard EKG. So you can see that from across the room if you know what you're looking at. So it's not a difficult diagnosis to make. Doesn't mean he can't have some stomach problems as well. I tell patients all the time, it's not either or. Oftentimes you're having the stress of a heart diagnosis that can increase your susceptibility to things like acid reflux and or even stomach ulcers. So let's not ignore the possibility of that being the case as well. But they should not be giving him all this heart medication, but he should be probably on a beta blocker and possibly something to control the heart rhythm. You have to appreciate how serious this can become very, very quickly. When the heart is not pumping blood forward, blood becomes stagnant. When blood becomes stagnant, blood clots. Blood clotting inside of your body is never a good thing. Blood clotting outside to stop bleeding is always a good thing. But blood clotting inside, particularly small clots, little microvascular clots, are what are responsible for, they plug up the vasculature of the heart. There are only two arteries, the right artery and the left artery of the heart. If one of them gets blocked, the right side artery takes care of 1/3 of the heart. So you could lose the entire 1/3 and most people will still function. You don't function great, but you do function because the heart is passively pumping blood. The left side of the heart is passively pumping blood that gets eventually back to the right side of the heart. But if you get the left side of the heart compromised, then you have a problem. That's when you have a massive heart attack. So the left main artery, or the widowmaker, as they call it, if it gets a tiny clot in there, it blocks and obstructs the plumbing. It's like plugging your toilet up. It can be a major problem very quickly. And then if microscopic clots travel through the heart and ultimately end up in the brain, that's when you get multiple micro strokes or mini strokes. And then you can end up with everything from dementia to full-fledged paralysis or diaphoresis. So it's important that I'm 100% sure that he's on low-dose aspirin. Depending upon certain criteria, you may need to be on blood thinners as well, and then something to control that heart rate. So if they cannot control it medically or chemically with pharmacological products, you sometimes have to have intervention where you can either ablate the nerve that tells the heart to pump, or a pacemaker is placed. So it can get real graphic, real challenging very quickly. So embrace the need for him to be treated for this, and please support that he stays constant with this treatment, because the only thing that can happen is something bad if he does not follow the protocols that have been outlined for him. Okay, great question, Don. Thank you. Trina Griffin, how do I get rid of cellulite on the thighs and also arm flings? Okay, so arm flings basically means that you lost weight in the arms. Now you have loose skin, and cellulite is nothing but basically lumps in the fatty tissue. So I'm from the South. In Atlanta, grits is a standard part of our breakfast. If you've ever eaten or prepared grits, you see that sometimes you get a lump in the grits. You can take your fork or your spoon, break the lump up, and it's still grits. That's basically what cellulite is. There is, losing weight, losing fat will decrease cellulite because certain things can literally remove the fat cells. When you lose weight under normal circumstances, fat cells never disappear, they just shrink. There is actual technology now that can remove, it can lyse, Lyse, the fat cells, releasing the fat and breaking up that cellulite. There are, you might have heard of cool sculpting. That was one of the things. The problem with cool sculpting is that it's difficult to get a smooth surface, and you end up with lumps and bumps that kind of give you a moon surface, unless the technician performing the task is very good and skilled at using that technology. But there are laser lipo, which Dr. Collier uses in his office. The laser lipo literally lyses the cells in about 15 to 20 minutes. Doesn't depend on the technique of the person doing it, because the machine, the computer, does it all. So that takes away that factor. You don't have to worry about that being an issue. There are also some ultrasonic ways of doing that as well. So check out some of the newer technologies that are available. Just Google treatment of cellulite. It's always on the thighs, sometimes on the buttock as well. You've seen women's buttocks that look like moonscapes. They have a lot of lumps and bumps in them. That's what cellulite looks like. Everybody wants to smooth it out. And so there are ways to do so. But losing weight in general, particularly if fat is what's being burned, you will get benefit from products like the lipo drops, which focus on fat metabolism and losing of fat. Great question, Trina. Okay, Thaddeus Brown. Okay, Thaddeus. Hello from Columbia, South Carolina. In regards to meds specifically for high blood pressure, is it true when you take a particular med, it depletes some minerals or vitamins in the body? How do you know what's depleted to replace? One, the diagnosis of high blood pressure in general can cause, just the stress of that can cause some vitamin deficiencies and some stress and strains, particularly on minerals like magnesium and potassium. So it's very important that you, any diuretic class drug, which would include chlorothalidone, hydrochlorothiazide, and chlorothiazide, can lower magnesium and potassium. So you want to make sure that you're replacing those, or at least monitoring that you need those. Most other blood pressure medications don't directly cause depletion of minerals or vitamins. It's the disease state proper that can do that. So again, I can't think of a particular medication that would have that negative effect in doing so. But what I recommend is that you remove the middleman and just make sure that you're taking a complete multiple vitamin. And the key word in that phrase is complete. Multiple vitamin with iron and minerals, and then various supplements such as omega-3 fish oil to help, and vitamin D. Those are the things that can optimize no matter what your disease state is: high blood pressure, diabetes, high cholesterol. All of those or none of those, you still will benefit from taking some of those supplements. So that is, make sure, most importantly, that you do get that blood pressure controlled to the levels that you need. A normal blood pressure is 140 or less systolic, over 90 or less diastolic. The top number is the systolic and the bottom number is the diastolic. And again, less than 140 over 90 is your goal and your objective. And it may take 2-3 medications to accomplish that objective, but whatever it takes to get it under control. Just lowering it a little bit does not help you. You need to be brought down to less than stage 1 hypertension. There used to be 5 stages of high blood pressure. What we found out is that once you got to stage 2, it didn't really matter how much higher your blood pressure got because you were at the highest risk at stage 2. So they just revamped the guidelines, and now they just say stage 1 and stage 2, and you want to be less than stage 1, which is less than 140 over less than 90. Again, this is a chronic disease. You cannot exercise it away. You cannot diet it away. You can improve your blood pressure by diet and exercise. You cannot cure it. It is not a disease state that can be cured once it has been diagnosed. It can be controlled, sometimes with just diet, but the vast majority of time, it requires medications. The biggest mistake that a lot of people make, they'll start taking the medication, the blood pressure is perfectly controlled, and they stop taking the medication because they say, oh, my blood pressure, I don't have high blood pressure anymore. Well, you don't, because you're on the medication. You stop the medication, your blood pressure goes back up, and it is very more difficult and more challenging to get it back under control than it is to maintain a state of control with high blood pressure. So you want to make sure that once you have a control, if a treatment regimen is working for you, that you stay on that treatment regimen. I know that there's a phenomenon known as pharmacological fatigue. You get tired of taking medication. You say, I have to take this medicine every day. But it's literally what you have to do. Because if you don't, the outcome is always an event. That event is a heart attack or a stroke. People of color, African Americans disproportionately are just always affected by heart attacks and stroke. It's what we die from. So we want to make sure that that is not the case. Particularly if you do a research of your family history, if either your parents passed away from a heart attack or a stroke, any of your grandparents passed away from a heart attack or a stroke, guess what? You're looking at your future unless you intervene, which is what we're doing by controlling the blood pressure. So great question, Thaddeus. We appreciate you and allow me to get a little more information out to all the listeners. Okay. Jackal or Jackal. Dr. Collier, how can I get my weight under control and do a good detox? I stress eat a lot. One, let's stop stress eating. You're conscientiously aware that you're stress eating. You just have to make a decision not to do that. And then you want to make sure that if you are eating, that you can eat those things that you like, but you also make sure you get a substantive and significant amount of crunchy fruits and vegetables. Everybody's got a vegetable that they like. Everybody's got a fruit that they like. Fruits that I recommend, things like grapes, watermelon, bananas, all very good. Apples, an apple a day, as they say, keeps the doctor away. All of those things provide fiber. They give you a sense of satiety so that you're not hungry. But stress eating doesn't mean you just eat because you're stressed, not because you're hungry. And so that always results in difficulty maintaining a good weight. So one of the benefits of the dual lipo drops products, now you can get the lipo night and the drops max, one for the morning you take before each meal, and the lipo drops at night. That will optimize your metabolism and keep you from turning food into fat and allowing you to help better get your weight under control. Make a conscientious decision, though. You have to decide that I'm going to do better. So I highly recommend intermittent fasting for you. That means you eat whatever you're going to eat within 1 8-hour period. That can be 8 a.m. to 4 p.m., 10 a.m. until 6 p.m. Probably need to finish everything you're going to eat that day no later than 8 p.m. Ideally, you want to eat before then, but you want to be finished eating everything you're going to eat no later than 8 p.m., but hopefully within at least 3 hours before it's time for you to go to bed. And don't snack at that point, even on the crunchy fruits and vegetables. You just have to make that one simple change. And also drink more water, up to 8 to 10 glasses per day. And when you drink anything other than water, that can be tea, that can be Coke, that can be anything else, Jack Daniels, wine, whatever you drink, you also get a glass of water, and you finish that glass of water before you get a refill on your primary beverage. If you get a refill on a primary beverage, you also get another glass of water. One, this will keep flushing your kidneys out and help you and benefit in so many different ways. But again, that also will help. Oftentimes, people misdiagnose hunger or thirst as hunger. They feel a craving, and what they really are thirsty, but what they do is eat something. Most of the foods have fluid in them, and so you do get some hydration from virtually any food that you eat. But the problem is that you're thirsty, not hungry. So always, whenever you feel the urge, it's a good idea to drink a full glass of water before you sit down to eat anything. That will decrease your stomach capacity, decrease the urge to eat. And once you feel full, embrace the feeling of fullness. Do not feel compelled to finish your sandwich, finish your food, empty your plate, as we've been told since childhood. You can save it or you can throw it away. Dr. Collier has found most recently in my weight loss journey that I will take whatever I order. Let's say it's a Chick-fil-A sandwich, cut it in half and eat half of it. More often than not, I'm perfectly satisfied with just that half. Now, I may save the other half for later in the day. I may throw it away. I may give it to someone. Now I'm creating a culture in my office where one person buys a sandwich and gives the other half to another person in the office. Everybody's got enough food going on and everybody's comfortable and happy and we're not wasting the food. So the question will become, one, I'm going to order a sandwich from so-and-so. Would you like half of it? And that helps tremendously as well, because the portions that we have in the United States far exceed what we should be eating. And if you pace your food, eat slower, then you'll have an opportunity to start to feel full before you're choking down food. One of the other reasons that we eat so fast is because we don't want that feeling of fullness in. So we'll eat fast and then we'll eat more than we should, and then we finally feel full, but now we're feeling bloated and uncomfortable. Okay, great question. Okay, Sam Jones, I'm getting cramps, Charlie horses in my legs and feet. What's that from? I only get them when I've been a certain way. What could be the cause? Well, Sam Jones, sounds like you need to do some stretching exercises because, like as Dr. Collier says, if you say, Dr. Collier hurts when I do this, then don't do that, bottom line. But stretching out your legs and your calves should be a priority. That basically you can stand against the wall, step back, put one foot against the wall, the other foot behind that foot. Then put your 2 feet together again. Fold your elbows over your chest and lean forward, keeping your heels on the floor. That will stretch your calves out. You will feel them stretching. And you do that, one, whenever you're feeling crampy down there, but also before you go to bed at night and when you wake up in the morning, you stretch those muscles out. If you sleep or you lie in the bed on your back and you have your feet under the cover, it forces you to point your toes down, which shortens your calf and predisposes you to having crampy type muscle spasms. So what I do is I put on footies and remove the bottom of the blanket and the sheet from my feet, so my feet are sticking up freely, and I can just point my toes straight up. I can pull them back if I need to stretch my calves if my calves are feeling tight, and that will relax my legs. But also you can do the exercise that I prescribed earlier to stretch your calf out at any time that you're feeling that way. Now, this can also be an indication of magnesium shortage or deficiency, or a potassium deficiency. One of the things that we used to treat cramps with was quinine. We used to be able to get quinine tablets. They took them off the market. But quinine water is the key ingredient in tonic water. So when you go to the grocery store and you get the tonic water that is used to make gin and tonic or vodka and tonic or whatever, you drink 6 ounces of that at night. You can add lemon or lime for a taste, but it doesn't taste badly. Drink that and you will find that will help regardless of what the etiology of the cramping is. It's a good, simple, quote, holistic way that you can treat that sign or symptom. If that doesn't do it, you need to be evaluated to make sure you don't have peripheral vascular disease or some other problem with your circulation, including clots in your legs that could be causing or exacerbating this. Okay, great question. Larissa, so blessed Greer. All right, so blessed. Too stressed to be blessed. My mother has been dealing with kidney disease for years. Now she is being told that in 2 to 3 years her kidneys will shut down. Is there a way to slow that process down? Absolutely, there is. As a matter of fact, a couple of the diabetes medications that are new, the SGLT2 class drugs, the 2 name brands are Farxiga and Jardiance. Both do tremendous work on the kidneys as a benefit, a side effect. So they are literally using those 2 medications in people with kidney disease that don't have diabetes. They're also using them in congestive heart failure and a variety of different things that you get great benefit from. There's also another particular drug called Collier that you can take that is also good for kidney disease. So one, your mom, if she has diabetes, you need to control her blood sugar very significantly and strictly. If she has high blood pressure, she needs to control her blood pressure. And you can slow down that path of deterioration and possibly even reverse it. Those medications that I talked about, the SGLT2 inhibitor class drugs, have been shown to reverse kidney disease. Now, one thing I want to talk to you about, Larissa, if your mother has this, you are susceptible as well. You need to start getting evaluated and monitored, because chronic kidney disease is in a lot of people in our population, and it goes undiagnosed until you're in a crisis status. So you need to have that monitored, get your kidney function tested, a routine blood test which checks your creatinine, your glomerular filtration rate, and your blood urea nitrogen or BUN, and then a urinalysis to check your kidneys, to check your urine for protein. Those are routine tests that can be done in any doctor's office, and just to make sure, because you have now a family history of chronic kidney disease, CKD, and you want to be monitored. Your children should be monitored, and everybody. But we can help extend mom from hopefully not ever having to have a kidney shut down. And because if that happens, she's going to either have to go on dialysis or get on the kidney transplant list to get a kidney replacement. So those are the end stage ways of dealing with this. But we found that there are much ways that we can slow this process down or even prevent that from being the ultimate outcome. Again, ask about SGLT2 inhibitors or Corindia is the medication. I say it's Corindia, I'm sorry. Corindia is a tablet that anybody with kidney disease should be taking, particularly if that person has diabetes. Okay, Larissa, keep us informed about your mom. We're going to keep her in our prayers. Franchetta Miles McGowan. My husband passed away in June. I'm so sorry to hear that, and you have my sincere condolences. My husband passed away, and lately I haven't been able to sleep or eat, and I just feel depressed and all alone. My blood pressure's been high. Any recommendations? Yes. Your husband just passed away in June. You're still in the grieving process. So grief is an appropriate response to the loss of a loved one. The passing of a spouse is the most stressful thing that can happen in your life, in the measurement of all things stressful. The loss of a spouse is, or a parent, is considered to be number one, number two, religiously. So very important. This is a time to embrace your spirituality. If you have a church home, spend some quality time in there and pray to your God, whoever that God is. Get that relationship going. Meditate, etc. If you feel that you're still, if you're compromised from the depression, you might benefit from taking antidepressants. There are several and many that would help under these circumstances, and it's appropriate. It's always appropriate to do so. But I tell my patients, there is no magic in a bottle. There's nothing that I'm going to give you that's going to make this get better. The great thing about it is time. Every day is better than the previous day. You will never get over the passing of your spouse. You will be able to get through it, however, and you will be able to deal with life in general. But this is not the time to be alone. Embrace friends and family members. Spend time with people, so you're not just sitting back constantly brooding and thinking about the loss of your spouse. You need to, do things like volunteer, become active in something that you're passionate about, so that you have something to do. And so you will find that the more you do, the more fatigued you are, and you will sleep better. But you can also get something to help with sleep. First generation sleep subs things that I recommend will be anything that contains Benadryl. So Tylenol PM, Advil PM has 25 milligrams of diphenhydramine in each tablet. 2 of those should help you sleep. It'll be out of your system in 4 to 6 hours, so you don't have daytime sleepiness the next day. It's perfectly benign. You can take it every day, or you can take it only when you feel as if you need it, and you will get, just better. Sleep deprivation enhances or makes the depression worse. It can cause anxiety. Your blood pressure is up because you're sleep deprived, and so all these things can ultimately result in you having a health crisis. So you want to make sure that you're being seen by your primary care provider. Your GYN may be able to help, but this is usually in the preview of a family physician or an internist, particularly if you have one you have a good relationship with. So please, Franchetta, keep us informed. We are concerned about you. We want to make sure that we get through this together. Thank you.
Erica Flowers Herring, will Januvia and metformin help with weight loss and control diabetes? Yes and yes, they will, but they are not the best options. Both of them will help control the diabetes. Neither has a negative effect on weight. There are some diabetes medications that can potentiate weight gain. And so the problem is all your insulins stimulate your appetite, make you hungry, but we tell you not to eat, but we tell you to take a shot that makes you eat. And so virtually anybody that's on insulin will gain weight because that's just the mechanism of action of the medication and one of the side effects of it. Januvia and metformin will help, but there are much better medications, the SGLT2 inhibitors. Again, the medication that I mentioned, Jardiance and Farxiga, they work by making your body urinate out excess sugar. It comes out in your urine. The benefit of that is you also urinate out the excess calories that come with that sugar. So you lose weight. You don't have to do a single sit up, crunch, go to the gym. Just having the diabetes disease state and taking those medications will make you lose weight. And then the granddaddy of all of them, the Ozempic and the Mounjaro, these injections are for people with diabetes, but their major side effect is weight loss. And so dramatically so. Weight loss at a rate that's compatible with a gastric bypass or bariatric surgery. A weight loss of approximately 30 pounds per 100 pounds has been observed. So this is, if you're not on one of those medications, then you're eligible because you're on metformin. Januvia, you can still be on both of those as well as one of the injectables, and you will, one, lower your blood sugar, two, lower your hemoglobin A1C, decrease your heart attack and stroke risk, improve your kidney function, and lose a heck of an amount of weight. And because you have the diagnosis of diabetes, your insurance company should cover the cost of that medication, the semaglutide, which is cash paying anywhere from $1,200 to $1,800 per month, $1,200 to $1,800 per month. But I had a patient today who got some of the Ozempic from her insurance company. It cost a grand total of $25. $25 for a month supply. Absolutely incredible. So we are so glad that she was able to take advantage of that because it's going to optimize her health as well. But again, check. You can call your insurance company, go on their website and see if it's covered. If not, just go to the doctor and tell them to write for it, and that will start the process. Because even if it isn't covered, there's a thing called prior approval that you can get. The doctor can basically make a request that you get this medication because you need this medication, and sometimes your insurance companies will cover it. Okay, great question, Erica. Mel Moore. Hi, Mel. I've been suffering from scleroderma. I'm so sick and afraid. Can you please offer advice? Okay, scleroderma is an autoimmune disease that predominantly affects the skin, but it can basically affect any of your tissues, non-muscle. So it doesn't affect the bones, doesn't affect the muscles, but it affects the connective tissue and the skin. It is thought to be autoimmune. It can vary in its severity. The treatment is predominantly steroids, but now with a lot of the new biological options for treatment that are benign medications, they don't, do have some of the side effects that steroids can have that you would get great benefit from. But it's an inflammatory condition. You treat inflammation with anti-inflammatories. The two most common supplements, again, omega-3 fish oil. I would take 3 to 4,000 milligrams per day. Usually most omega-3 fish oils over the counter are 1,000 milligram capsules. You take 2 in the morning, 2 in the evening. You can take it without food, but it is better absorbed with food. A quality product has a clear, you take one of the capsules and look through it, it's crystal clear, not cloudy. And when you open it up, it doesn't smell fishy. You can go to our website, lipodrops.com, and get our Lipo Omega, which has 1,480 milligrams in each capsule. You can just take one of those in the morning, one of those in the evening, and you'll get benefit. And then, of course, vitamin D at 5,000 international units per day will give you great benefit as well. So, Melmore, again, you if you have not been treated with steroids, you probably will be and or should be. Other treatments available, but ask about some of the newer biologics that would be possibly directly indicated. But if not, you take it and you'll just get benefit from it because of its mechanism of action. But they started off with these medications to treat one disease, and now they're treating everything from arthritis to irritable bowel syndrome, colitis, ileitis, psoriasis. Virtually almost any kind of autoimmune disease is the patients are benefiting from taking these biologics. So there are specific ones for specific types of disease states. So you need a doctor that understands when to use them, how to use them, etc. So if you have scleroderma diagnosis, you need to be under the care of a rheumatologist as as one of the doctors on your team, a primary care physician, family doctor, or internist, and a rheumatologist are your healthcare team. And you, the three of you, those three people are going to be responsible for how well you do and what kind of outcome you're going to have with this disease state. Unfortunately, there is no cure for scleroderma, but the symptoms can be controlled. But it's very important that you see if there's anything that makes it flare up, anything you do, anything you eat that you see. It's important that you stay in a restful, low stress state, because stress and anxiety can aggravate any autoimmune disease. And make sure you're getting 6 to 8 hours of sleep every day. Virtually almost impossible for a person that works for a living, particularly for a woman if you have children. But you got to do what you got to do for self-help and for self-health. Help and health. Okay, great question, Melanie Moore. What can I take to stop my hair from thinning? I think it's a bad diet. Smoking weed. Anything I can't take since I quit to boost the production of hair on my head, like an African secret. Boy, if I knew an African secret for hair restoration, Dr. Collier would be a multi-billionaire. Okay, so there are new techniques and technologies for hair, but hair thinning and hair loss is thyroid disease or anemia until proven otherwise. You need to be tested for those two things immediately. If you have either of those, they need to be treated. And then again, oftentimes there's an inflammatory condition, there are hormonal abnormalities, so you can do hormone replacement therapy that would help with that. There's new technology, including a laser stimulation of the scalp. There is, again, transplants of hair plugs from the sides and the back of your head where the hair grows to areas that it's not growing. And this is amazing technology. It's gone from making it from bundles of hair that made your hair look like a hairbrush to now smooth lines and you can't tell, and the hair does grow. And of course, there are products like minoxidil, which can be taken orally or topically. You can put minoxidil shampoo, spray, or gel on your scalp, and it will make hair grow almost 100% of the time. The problem is if you stop using minoxidil, your hair will quickly revert back to wherever your hair loss state would have been. So it literally starts to come out. So once you start that process, you're kind of stuck doing it, but it does work. So again, it's going to require you to work with a dermatologist, again, and a primary care doctor, family physician, or internist that understands how to treat hair loss and working together to optimize that. And the quicker you start the therapy, the better, because the more hair you lose, the more difficult it is to grow back. As soon as you've already identified your hair is thinning, so right now that means you probably don't have any bald spots, so you need to work on it immediately. But it may require addressing all of those things. Let's say you have a little anemia or you have a little thyroid disease. You want to optimize your thyroid hormone levels and then take a complete multiple vitamin with iron and minerals. There's no such entity as a generic vitamin. A vitamin is a fixed chemical formula. So make sure when you purchase one that the label states a complete, not just a multiple, because the multiple is just more than one. A complete multiple has every vitamin that exists in one pill and at maximum therapeutic dosing. So you want to make sure that you can get it all in one pill. And you should be able to get a reasonably priced vitamin, 100 tablets for less than $15. So if you see a branded product, say for instance, one a day for women, right next to it says the Kroger brand, the Publix brand, the Target brand, compared to one a day for women. It's the exact same thing. It's a fixed chemical formula. There is no better way to make it. If you're spending an exorbitant amount of money on a basic vitamin, you're paying for a pretty label or a celebrity endorsement. So you need to get the least expensive vitamin that you can. Again, there is no better way to make it. Just long as the label states and the actual what the label says is what's in there. Sometimes some of these supplements are not they don't contain anything that they say on the label, or they contain different and varying amounts. So you want a good product that has quality controls with it. So if it's a store brand, it usually means that it does have that. And then there are a few brands that you can count on, like Nature Made. I know that Sam's and Walmart have their own brands that are really high quality and not expensive. So find one that meets that criteria and start taking that, regardless. That will optimize your health. But good luck with your hair loss. And as usually we all getting thin, that hairline is going back a little bit. Dr. Collier is noticing it as well. So, and again, I'm getting to be concerned about it. So I'm starting my regimen. Okay, thank you. Keeping up, Kiki. Are you familiar with adenomyosis? Can you recommend a treatment for me? Adenomyosis. Osis means condition of. Adenomyosis is usually a condition that affects your female health. And that, again, it's an inflammatory process. So it also can be related to various hormone levels. So you need to make sure that you check your hormonal status. That may require, that will require blood testing, but then also a basic physical examination, including a pap and pelvic exam, possibly an abdominal ultrasound, to see what's going on down there, and to minimize the amount of hormonal stimulation that is you're getting to the adenomyosis disease state. So again, osis, condition of. Itis means inflammation of. So that means a condition of adenomyosis, and it usually affects a woman in the female organs. And so you want to make sure that that is treated and all controlled. Great question, Kiki. Charlene Howard. Good evening, Dr. Collier. I have lupus. This is what's going on. My right chest hurts all the time. I had a chest x-ray. My doctor said my chest is clear. That's good news. That means it's just inflammation from the lupus. Lupus, again, is an autoimmune disease of inflammation that causes inflammation of the tissues. It can affect the lungs. It can affect the heart. It can affect the skin. Oftentimes, people with lupus will have hair thinning, hair loss. They will have a rash on the face. And the reason it's on the face because of sunlight exposure. You're looking, sun that's coming through the windshield in your car and that kind of stuff. So that rash is usually above the eyes and below the eyes. And it's called a butterfly rash because it covers that area. And like this is the body of the butterfly here with the wings here. And so it's a very distinctive rash that you can get. There are some newer, exciting treatments for lupus, including biologic products that I spoke about earlier. You need to talk to your rheumatologist, and sometimes you have to ask for these treatments because they are not the usual and customary. They are new and they are expensive. So your insurance company is going to push and balk about giving it to you. But again, if you fight the good fight, have the doctor help you get access to some of these medications, then you will find that they can be life-changing. But again, the problem in your chest is inflammation. You need to do basic things to lower the inflammatory condition. That would be vitamin D at 5,000 international units per day, available now on our website, lipodrops.com. Omega-3 fish oil, which does a variety of different things to improve your body's total inflammatory condition and inflammatory disease states. There are things like turmeric, cumin, that are available in powders, capsules, tablets, teas, virtually anything that you can do. All of these things that are good, and then anti-inflammatory food sources that are also good to lower. So I would Google things that I can eat that are anti-inflammatory, then supplements that you can take that are anti-inflammatory. Whatever you do, the main thing is keeping that lupus under control, because if it flares up, it can really, really be a problem, of course. And the chest pain can go from being chest pain to lung disease and or heart disease. Fortunately, it's the right side of the chest. The heart, when it hurts, it's either in the center of the chest or on the left side of the chest. So without question, it's not heart issues right now. It's just the inflammation. Unfortunately, your chest x-ray was clear. So that just tells you what it's not. That doesn't tell you what it is. Things that need to be measured and monitored are your erythrocyte sedimentation rate or SED rate. That's one test for inflammation in the body. The other is called the HS, or high sensitivity C-reactive protein. Those are two inflammatory markers that are monitored in disease states such as lupus. And every time you go to the doctor, you need to get those checked. And you need to be going to the doctor at least every 3 months. This is now you and your doctor in partnership. You can't miss appointments. You cannot not do some of the things that they ask you to do. Some of them may be challenging or, disruptive to your lifestyle, but you got to do what you got to do to keep this lupus disease state under control. Okay, and then confirm that the diagnosis is actually lupus. I think lupus is sometimes overdiagnosed. There is no lupus test. There is no disease state that's positive or negative for lupus. Lupus is a disease state that is diagnosed as a diagnosis of exclusion. Between the signs, the symptoms, some of the lab results, and the things that you tell the doctor as far as what the symptoms are that you're having, then that makes the diagnosis. But if you have the hair thinning, the butterfly rash, that kind of makes it easier to do it. But sometimes I get people that have a diagnosis of lupus and they've been misdiagnosed. It's just not lupus. So you need to confirm that that is indeed your disease state first. And make sure everything has been done to confirm that that is the disease state. And then every treatment option that's available is being made available to you. Okay, it's a complicated disease process. It's no fun. It takes time. Don't let the doctor bum rush you and rush you through an appointment. Make sure that if you have questions, if you have concerns, write them down and get to every one of them during your next appointment. Don't be told, well, we're going to deal with the top two things. No, we're going to sit down, let's make eye contact, and let's work through this together because I'm having problems. And, just because the x-ray was negative, again, that's just telling you what it's not. It's not telling you what it is. And that's just a picture of the problem or a picture of what's not a problem, but it hasn't changed the treatment. And so the objective is you want symptomatic relief as well as you want to be informed and a correct diagnosis being made. So good luck, Charlene. You hang in there and keep us informed. I want you to be a regular on Wednesdays at 6:30 and let us know. Give us an update next time. Okay. Raymond Mosley, lipo drops. Do you have to diet or eat a certain amount of calories? If you follow a diet, there are two diets that we recommend with the lipo drop weight loss program. Two diet that consists of eating 5 meals per day. That's breakfast, lunch, and dinner. A snack in between breakfast and lunch, a snack in between lunch and dinner. That way you never become hungry. And when you never become hungry, you don't overeat because you're not stressed. You don't feel that way. You're just eating because it's time to eat versus I am hungry. Your body interprets this as I don't need to store food as fat because I have fresh food or fuel coming in on a regular basis. So your body recognizes this, and at first it stops storing fat. And then once it realizes that you are serious, it says, well, hey, not only do I not need to store fat, I can let go of the fat that I have been storing as fuel because I'd rather have fresh fuel that's coming in real time on a daily basis versus trying to convert fat back into fuel, which is a difficult process for the body and one that your body doesn't like to do. That's why it stores fat, but it doesn't like to break it down. But once you're giving your body fresh fuel or food around the clock, it recognizes this and it starts to let you lose the fat that's been stored. Now, the second option is intermittent fasting. That means you eat basically whatever you're going to eat within 1 8-hour period of the day. Again, that could be 8 a.m. to 4 p.m., 10 to 6, 12 to 8 p.m., but definitely under no circumstances should you be eating after 8 p.m. And unfortunately, that's our lifestyle now. We make dinner reservations at 8:30, 9 o'clock. We go eat a 7-course meal and come home and go to bed. Guaranteed to put weight on you. And oftentimes around the abdomen, and for the ladies, the hips and thighs. So important that you make that one change, that you try to eat everything that you're going to eat no later than 8 p.m. And if you work a different shift or you got a different lifestyle, whatever your 8 p.m. is, or at least 3 hours before you go to bed at night. In doing so, you can't do late night snacking. You can't sit in front of the television at midnight watching your favorite movie and snacking on ice cream. That's a guaranteed weight gainer. So the amount of calories depends on a variety of things. But for most people that are on a weight loss diet, for a man, 2,000 to 2,500 calories a day. For a woman, 1,500 to 800 calories per day, if you want to limit calories. But again, the objective with the lipo drops weight loss plan is not to limit your calories. It's to control your metabolism so that your body is not storing fat and then burns fat. A diet that limits your calories will always result in weight loss 100% of the time. Every strip mall diet that is available, there are 13 of them. And when I say strip mall, I mean the quick weight loss, the weight be gone, the I'm too fat, the Weight Watchers. All of those where you go to a place and you go to a club and you have weight loss, even though they're doing a lot of this online now. They all restrict calories, and guess what? They all work. If you do what they tell you to do, exactly the way they tell you to do it, you will lose weight 100% of the time. The problem is, as soon as you stop doing it and resume a more close to normal lifestyle, you gain the weight back, oftentimes exceeding. Most people will lose the average weight loss on a diet like that is 20 to 30 pounds. The average weight gain is 30 to 40. So you lose the weight, you gain it back. But more importantly, you shift your body's somatotype, because when you lose weight by decreasing your calories, you lose a balance of muscle and fat. But when you gain it back, you gain back fat only. So if your starting weight was 200 pounds, you lose down to 170, and then you gain back up to 200 or 205 or 210. You have shifted. You have now more body fat and less muscle mass. And even though the number on the scale is exactly the same, the clothes that you were wearing before no longer fit. And now your body is soft and doughy, and you're less physically fit and more susceptible to diseases such as high blood pressure or diabetes. So important that if you lose the weight that way, that you have to stay on that diet strictly. You cannot revert back to normal eating. That is why we don't do that anymore. Those that are in the weight loss knowledge field, we try to alter your metabolism, because you can do that. You can keep your metabolism altered. You can continue to eat in certain things that you enjoy doing, but because we've shifted your metabolism, you're going to lose weight and, more importantly, maintain the weight loss. I tell people I can get 50 to 100 pounds off of you, but the point is, where are you going to be 6 months from now? I want to keep it off of you. I don't want you to just lose it and then bounce right back. 80% of people that lose weight that way gain the weight back. If you've ever seen the television show The Biggest Loser, 98% of those individuals gained all the weight back within 1 year. 98%. So they would have dramatic weight losses, but it was impossible to sustain. Nobody has foods prepared by a chef all day and then exercise all day. Regular people can't do that. If you work for a living, if you have a family, you have children, that is not sustainable. So it was an unrealistic expectation. So now, though, again, by altering your metabolism, which is what we can do with the entire LipoDrops line, particularly LipoDrops Maximum Strength Formula and the Lipo Night, you can, again, alter your metabolism, metabolize that fat, and lose the weight. That's what we want you to do. Okay, Raymond, you got the information you wanted. Sierra Witcher, what causes recurring UTI symptoms off and on? I've been drinking water and eating a healthy diet. This is something that just can happen to some, particularly women. It's more common in women because the urethra in a woman is, 3/4 of an inch, half an inch to 3/4 of an inch long. In men, it's the length of the male penis. So bacteria that can get into the distal portion of the penis just sits there until a man urinates and pushes it out. For a woman, that short distance of the urethra, bacteria can climb up into the bladder and cause chronic urinary tract infections. The physical act of intercourse can predispose you to bacterial infections, particularly anything other than the missionary position, any rear entry positions, if you will. Rub the penis past the woman's anus, and it pushes E. coli bacteria up into the vagina. That can cause a urinary tract infection as well. Some women are just susceptible to them. So you're doing one of the things you need to do, drinking water. Cranberry juice is also very good. Cranberry juice does not kill or cure a urinary tract infection, but it is very good at preventing urinary tract infections, and it can get you through the weekend if you can't get to the doctor's office till a Monday and you're trying not to go to the emergency room or urgent care just for a urinary tract infection. So there's something inherent in the skin of the cranberry that makes the lining of the urinary tract, and the entire lining of the urinary tract, they call it urothelial cells, very susceptible to bacterial infections. But something in the cranberry, the skin of the cranberry, stops that from happening. So it cannot attach, it cannot set up an infection in there. So cranberry juice is a good thing to have in your diet. After intercourse, which is the most common time that women will get a urinary tract infection, you should, one, police the area. I recommend, because you don't want to break the romantic mood. Nobody wants you to jump up immediately after sex and go wash yourself or take a shower, because it just breaks the mood. Everybody wants cuddle time, snuggle time, emotional bonding. That's an important part of the act. It's just as important as the act itself. So you can keep just a soapy wet washcloth on the nightstand and at least police the area. or use baby wipes. I like the non-scented baby wipes just to remove bacteria. Remember what grandmama told you, wipe from front to back. And then when you get up and urinate after a few minutes, you can get up, empty your bladder, and blow out any bacteria that maybe have been pushed in there by the physical act of penetration. So I say, drink a glass of water before sex, so by the time you've completed the act, you got urine in your bladder, you're ready to urinate. So you can go do that at a reasonable period of time after the act is completed. You police the area, then before you go to bed. Don't go to sleep in the wet spot, as they say. Take a good shower, clean the area, and produce it that way. Okay, Sierra, that was a great question to close on. And this brings to an end. Okay, Marvette. Okay, Kiki. Okay, we did it. This is bring to an end. This episode of the ASK Dr. MJ talk show host on Facebook and Instagram. So we are so glad that you joined us tonight. We hope that you found this to be a very, very informative show, and that you will tell your friends to tune in, because this is an opportunity for you to ask your healthcare question and get healthcare information that will help you. So we want to make sure that you join us again on the second and fourth Wednesdays, 6:30 p.m. Eastern Standard Time, and we're going to answer your healthcare questions. Of course, all of this information is available on the LipoDrops website. Go to the LipoDrops website right now, and you get more information about it. And look at our products. Dr. Collier's Trio is recommended. That's omega-3 fish oil, probiotics, and vitamin D. There's a thing on it. You see the scrolling banner. Lipo 3, the Lipo T 3-pack is 31% off. Men, get that Lipo T so you can have a great month of September. We want to hear about you. Labor Day is gone now. There's not going to be any more vacation time until Christmas time and Thanksgiving. So you want to have as much recreation as you can. So get your Lipo T. You'll be good to go. Thank you and good night.